All right. I believe we are live for this session tonight, or today, I should say. I'm Baxter Bell. I'm a yoga therapist and physician. I live in Oakland, California, in the United States, and I'm excited to share with you today some information around the use of breathing techniques, in particular pranayama techniques, to address the health of the lungs in relationship to COVID-19. So let me tell you just a little bit about myself since there was no one to introduce me. I've already mentioned that I'm a physician. I was a family doctor for many years. Presently, I spend most of my time doing yoga therapy with clients, teaching yoga, therapeutically based yoga classes in the United States, and traveling and teaching around the world to both people in training to become yoga therapists, as well as to become yoga teachers. I also am a medical acupuncturist. That's a physician, an MD in the United States who also offers acupuncture to his clients. So I wear a lot of different hats, and today I'm going to wear that hat where I'm going to try and straddle or step between the ideas of yoga therapy, pranayama, and what we know about the lungs and infections. I became interested in this idea or this possibility of utilizing pranayama to optimize lung function in people who might be exposed to the virus or who might have early symptoms of COVID-19 about a month and a half ago. I happened to notice in my Facebook feed, or maybe it was actually on YouTube because I post videos there, that there was a posting from a physician, a doctor in the United Kingdom, in England, describing in about 3.5 minutes a technique that they were using in their hospital system to try and help the patients that had come in with lung symptoms related to COVID-19. He went on to describe a technique that was fairly straightforward and simple. He encouraged us to take a deep inhalation and then hold the breath for 5 seconds. And then after that, let the breath go. This was repeated 6 times for 6 breaths. And on the sixth breath, you were encouraged to cough into your elbow or your arm once or twice. You then repeated that cycle of 6 breaths in that particular pattern one more time. Following that sitting practice that I just described to you, the patients were encouraged to lie down flat on their belly, prone, placing a pillow or a little lift underneath the chest and head. So for the yoga practitioners that are tuned in today, you could imagine a very low sphinx position or a low cobra position with a little bit of lift underneath the chest and the head. In that position, the patient was encouraged to breathe in and out a little more deeply than they would normally, not dramatically so, but a comfortable, moderate breath in and out while lying on the belly. And they were encouraged to do that for up to 10 minutes. So that little process, part one, sitting with the 6 breaths repeated twice and the cough at the end of each round, followed by lying on the belly, flat down, with a little lift underneath the chest and head for 5 to 10 minutes. Could be repeated any number of times during the day. And the doctor from the United Kingdom reported that this was helping their patients in the hospital to improve their breathing. And it seemed to be reducing the number of people that had to be placed on a respirator, a mechanical respirator to assist in the breathing. So this was very intriguing to me. I was very surprised to see this. And immediately I was interested because they were recommending a breathing technique to their hospitalized patients that sounded vaguely like pranayama. It wasn't exactly like pranayama, but the holding of the breath at the top of the inhale would be a kumbhaka, right? A hold that we talk about and teach to our students in our yoga classes and in our yoga therapy sessions. And so I was very interested to think about the whole process that they were teaching and whether or not we might actually be able to do better by applying what we know in yoga therapy to refining the pranayama that they were already teaching their patients. A short while after that, I came across yet another video online from a doctor in the United States. And he was basically describing the exact same technique that the doctor in England had described. So I thought that was interesting that this information was starting to spread across the ocean, and that doctors in the United States were now also recommending this to their colleagues and to patients and to just the general public to think about this breathing technique. And in fact, the physician in the United States suggested that people who are not sick and who have not been exposed to the virus might start to practice this breath technique as a potential preventative technique. Now, I want to be very upfront here. Neither of these doctors were indicating that this was going to prevent someone from getting sick or was going to reverse the breathing problems that they were having. But they did say that from anecdotal evidence, from observing what was going on in the hospital, that it seemed to be helping people to get better more quickly and for some people to avoid having to go on a mechanical respirator. This seemed like a win-win situation for everyday people and also for people that might have to be admitted to a hospital with lung complications of COVID-19. We now know after several months that COVID-19 can also affect the gut, it can affect the heart, and it can affect many other systems in the body. But predominantly, the main thing that seems to be most common is this effect that it has on the lung tissue. So I was also curious to see if I could find any reasoning out about why this would be effective. And sure enough, about a month later in the New York Times, there was an article talking about what was going on in the intensive care units, in the ICU, in many hospitals around the United States. And what they described was a process of lying the patients or turning the patients over to lie prone on their belly in the ICU while still on a respirator. And as they explained in the article, and as many of you may know already, we have more lung tissue, more of the alveoli, the small air sacs in our lungs, reside in the back half of our lungs as compared to the front half or the anterior half of our lungs. And what happens typically is a patient becomes sick, either at home or in the hospital. They typically lay on their back, supine, and they do that for many, many hours. And that position and the effect of gravity on the lungs causes the lungs in the back half of the lungs to collapse. And so airflow is diminished. It does not flow as well. And therefore, this can worsen the oxygen transfer from the lungs into the bloodstream. And so we see that the oxygen levels in people's blood are dropping, and this is aggravating their overall condition. Interestingly, we've known for a while, there are several studies that point this out, that if you change the body's position and have someone lie on their side or lie on their belly, that can actually improve the airflow in and out of the lungs. And so in the intensive care units, when people are intubated, they were flipping them over and having them spend as much as 8 to 10 hours a day lying on the belly. Now you can imagine in the intensive care unit, this takes several staff members to do it. So it's not easy to do. It takes a lot of time and care to place people that already have the tube down the throat. So they started also suggesting that their patients on the regular floor who weren't at the place that they needed to be on a respirator, that they start spending more time lying on their belly. So that's some justification for the second part of the two-part practice that I described to you earlier. In terms of reasoning for why the first part might be effective, there's no real specific studies done either on COVID-19 patients or other patients, but respiratory therapists in hospital settings for a long time have encouraged deep breathing with patients after surgery, patients who have lung disease that come into the hospital. They actually have them take deep breaths in and out. They have them use a spirometer that they blow in and out of to create resistance to work the lungs and the muscles of the lungs more effectively. So I think those reasons that are used in those settings would apply for this technique that is being described as well. So having thought about this and read some articles and read some reviews and some information that was posted both in technical journals and in the media, I started playing around in my own personal practice with developing a new updated version of the technique described. Now, some of you might be scratching your head and saying, well, if it's not broken, why fix it? But someone else out there might say, you know, if the technique was just adequate, we would have never gotten to the moon, right? So sometimes, even though something works pretty well, we can still improve it. So in my home practice, I started to think about something that the doctor from the UK mentioned in the video that he describes his technique. After doing the technique and having us try it with him, he mentions that he was actually lightheaded and a little bit short of breath. And my thought immediately, having watched him do the technique, was that he was hyperventilating, that he was taking a very quick, deep breath in. He was holding his breath for 5 seconds and then just mindlessly exhaling. He wasn't doing anything thoughtfully with his exhalation. So, knowing what I know about the physiology of breathing and how that can play out with our pranayama techniques, I decided to do an equal inhale exhale. And I thought, if I'm going to try and take a deep breath in, why not do it a little more slowly and mindfully, and then let the exhalation be the same length? And since we're holding the breath for 5 seconds, to make it easier for everyone doing the technique, I thought, hey, I will inhale for 5 seconds, pause for 5 seconds, holding the breath, and then exhale out for 5 seconds, and maybe allow 1 second before I take the next breath in. I started to practice that every morning in my pranayama practice before I meditated. So I would do 6 rounds of breath. I would cough on the sixth exhalation. I would repeat that 6 more breaths. And then I did not do part two, lying on the belly, until later in the day when I did my asana practice. And at the end of my asana practice, when I'm lying prone on the floor, I then set a timer and do the deeper breathing in and out. So I found that that was very easy to do in my home practice. I realized that for some patients, we would have to work them up gradually, maybe taking a 2 or 3 second inhale, 2 or 3 second exhale before we get to 5 seconds. Oftentimes in the United States, in training, we often tell our students to be cautious with holding the breath at the top of the inhalation, that can elevate the blood pressure and maybe make it difficult for people who have heart disease. Curious about that, I have an automatic blood pressure cuff at home. I checked my blood pressure before I did the technique, and I checked it after the 12 rounds of 5 second inhale, 5 second pause, 5 second exhale. I found that my blood pressure either was unchanged or was better at the end than at the beginning. And I found that my pulse only went up about 4 or 5 beats per minute. So there was not a great deal of change in terms, there was, in fact, I felt like the effect was actually beneficial for my cardiovascular physiology. I checked this on several days. So I was conducting a scientific study with an N of 1. And of course, I was that one person. So I realized that the next step would be to try and encourage those of you in the listening audience today to consider communicating with one another and try to establish a study that we could do probably very easily with yoga practitioners, people that already do yoga, and people from our families and communities who do not practice yoga regularly. And we could actually design a fairly simple yet elegant study to see if this is actually an acceptable practice for everybody without developing any side effects. So that is, I've just described my new technique. I've given you a little bit of information about what I observed in my own body. I felt that it was very accessible and easy to do. And the numbers that I got back from using my blood pressure cuff were reassuring. Now, I have found several follow-up articles online talking about the video that I described to you. And they mention that this is not a panacea, and that at this point we are theorizing and hypothesizing that this technique may be beneficial for people. I'd like to mention a doctor in the United States named Loren Fishman. He's located in New York City. He's a physiatrist and a yoga researcher. And in his one of his books entitled Yoga for Osteoporosis, he mentions that yoga is an excellent tool for almost anyone. Number one, it's relatively inexpensive. And once you learn the techniques, you can do it on your own. It's very accessible, meaning we can teach it to almost anyone. We can teach yoga to people of any age, which is really good because a lot of older adults are the ones that are more likely to die if they contract a serious episode of COVID-19. He also mentions that it's portable, that we can take it anywhere that we go. So when people do start moving around the country, in India, in the United States, they can actually practice these techniques on their own. So I think that that is the basic information that I wanted to share with everyone. I will mention to you that on my website, baxterbell.com, baxterbell, lowercase.com, and I'm hoping that maybe my team that is listening in can put that in the chat window for you. You can find a link on my blog site for a blog post that I did on this very topic with links to the two videos I've talked about, as well as the New York Times article that I've referred to. So you'll actually be able to access that information. And I also created a video that you can practice with, but I thought we might take a moment now to actually, I would like to guide you through the part 1 practice for a round of 6 breaths. So I would like to invite you to take a moment to reposition yourself as you would for meditation or for sitting pranayama. So sitting very nicely and lengthening upward from the tailbone all the way to the crown of the head. You can keep your eyes softly open, or you can close your eyes if you can hear my voice and you can understand my language easily. I'm going to ask you to begin by taking a really good exhalation and use your diaphragm and belly to squeeze the breath out fully. And on your next breath in, let's breathe in for 5 seconds, 4 seconds, 3 seconds, 2 seconds, 1 second, big full breath. Pause for 5 seconds. 5, 4, 3, 2, 1. Exhaling for 5 seconds. 5, 4, 3, 2, 1. Pause for a moment. Let's take a 5-second inhalation. 1001, 1002, 1003, 1004, 1005. Pause, hold the breath for 5 seconds. 4, 3, 2, 1. Exhale for 5 seconds. 4, 3, 2, 1. Relax for 1 moment. Inhalation for 5 seconds. 1, 2, 3, 4, 5. Hold the breath in for 5 seconds. 4, 3, 2, 1. Exhaling. 1, 2, 3, 4, 5. Another breath. Inhaling 1, 2, 3, 4, 5. Nice full lungs. Hold the breath. 5, 4, 3, 2, 1. Exhaling. 5, 4, 3, 2, 1. Our 5th breath in. 1001, 1002, 1003, 1004, 1005. Holding the breath. 5, 4, 3, 2, 1. Exhaling 5 seconds. 1, 2, 3, 4, 5. Relaxing for a moment. Our final breath. We're going to cough instead of exhaling as we've been doing. Inhaling for 5 seconds. 4, 3, 2, 1. Hold the breath for 5 seconds. 4, 3, 2, 1. Now a nice strong cough. And again. And then relax your breath. You would do that for 6 more cycles of breath. And then if you felt like you wanted to do part 2, you would lie down flat, maybe on your bed or the floor on a sticky mat, your practice mat. Elevate the chest and head a few inches off the floor, breathing gently in and out a little deeper than normal, maybe setting a timer so that you could do that for anywhere from 5 to 10 minutes. That whole process could be repeated a number of times during the day. So that completes my formal presentation. I'm going to take a look over here and see if my team can send me any questions on the little sidebar. Um, can we do external retention also? Could you define what you mean by external retention? I'm not exactly certain what you mean by that phrase. So let me see if someone will clarify that for me. What do you mean by external retention? In our example of what we were just practicing, oh, hello? Oh, thank you. So what I would say about holding the breath after the exhalation, you could do that. It might add some additional benefits. It might allow for a little bit more relaxation of the nervous system, since we know that usually holding the retention at the top of the breath or after the inhalation can be more stimulating to the nervous system. Although my little, experiment did not show that it affected my heart rate or blood pressure significantly, you could add that in as long as it wasn't complicating or didn't make it more difficult for the students, the clients, or the patients. It would be something you could add in as long as it's not more complicated for people to do. I don't know if I'm still on Zoom. There was a question. Oh, yes, I am. So perhaps the people that are on Zoom with me, I can hear you if you ask me a question, and then I can share that with our audience on Facebook. I'm in two worlds right now at the same time. I can't hear you very for you to turn your volume up or to speak louder for me. Yes. So thank you for asking that. I did not check that yet. That's my next step of investigation, is to check my blood pressure before doing the prone 10-minute practice and then checking it right after. My guess is because it is a restorative posture, meaning we're not actively doing much other than getting ourselves comfortable and then simply taking a slightly longer inhalation and a slightly longer exhalation, that we're going to find that blood pressure and pulse will probably remain the same or will lower down a little bit. Having said that, I will say that for some patients who have respiratory problems or heart disease, we would have to see. We would probably want to be more cautious with those people. And some people who have a physical build where they have a larger abdomen, a protruding abdomen, might find it actually very agitating and uncomfortable to lie flat on the floor for that period of time. So we might have to break up the 10 minutes into some shorter intervals of 3 minutes or 4 minutes, allow that person to come up to hands and knees for a moment, and then go back down and finish to make it more accessible and more acceptable for that particular individual. Okay, let me take a look at that. Hold on. Why is there only 6 breaths per minute? Again, there was no rationale provided initially by the physicians in the United Kingdom or in the United States in terms of, how they did their timing. The only timing given there was a 5-second hold. So you could probably actually do many more breaths per minute if you're only doing a 5-second hold and you're taking a quick inhale, holding it for 5 seconds, and then exhaling, right? So um, I think that, again, we could experiment a lot with how long we make the breath cycles. And I know that there are some ideas in the yoga world that certain timings are more beneficial than other timings. However, a lot of that has not been really rigorously investigated from what I have studied so far. And there may be others of you out there that have looked at this more closely than I have. But of course, these things are sometimes described in yogic scriptures. And then, of course, I always love to see if we can find Western ways of evaluating the physiology of those breath cycles to see if they actually match what is described in the yogic scriptures in terms of the benefits on health conditions and things like that. So I'm a little bit skeptical, but I spend most of my time in the yoga therapy world. So I certainly use these techniques with my yoga therapy clients on a regular basis and find that for many of them, they find them very useful. Are there any other questions before we wrap up this session today? I think you asked me if you have to do them back to back, meaning part one, as I described it, and part two, or can they be separated as I've actually been practicing them? Was that your question? Um, I don't think there's a clear answer. There's a lot more unanswered questions than we have answers for. For instance, I don't know if the part one is actually more effective than part two. In other words, maybe all you need to do is part one and not part two. I don't know if part two is actually more effective than part one. And maybe you don't need to do part one and you only need to do part two to get the benefits. No one has looked at those two things separately. So there's a lot of unanswered questions. I would suggest that you could do them back to back or you could separate them. And I would think you would get fairly equal benefits from doing that, as long as you try to do both of them in a given day or do both of them several times during the day. This is just an educated guess on my part. We'll have to play with that with ourselves in our own home practice and with others to see if that bears out for other people. I am looking, Dr. Rain asked me, does blood pressure change when breathing is done lying on the belly? And I addressed that already. I don't know that there are any other questions that I can see here. Um, okay, you have another question for me? That's an excellent question. Um, I am theorizing that most people will experience a decrease in their anxiety levels, primarily because we are giving them a tool that empowers them to have an impact on COVID-19. Right now, we feel very powerless. There are no proven medications that are going to have any significant impact at this time. We don't have any evidence of a good medical treatment for this condition. We are simply reacting to worsening conditions by putting people on ventilators and covering them with antibiotics, hoping that that has some benefit. But at this time, we don't really know if those things have any benefit. So if we can empower our patients and our clients to have a practice that they can be doing, this may indeed be preventative. We may find that this is a preventative technique that we can use, but only time will tell. So my hope is that it will lower anxiety levels, and improve their overall sense of well-being because they have a tool they can start applying in their own lives. Um, Someone mentioned that the prone position will increase the internal pressure in the abdominal area. Indeed, especially for people who have a larger abdomen, there can be back pressure up against the lungs, and that could make it more difficult for some people to breathe. So I think we'll have to kind of work with the individual clients and think about what their unique situations are, as we always do as yoga therapists. We meet the individual as a whole person with unique features, and we'll have to modify that for folks. I did read, I think, in one article that they were utilizing a table that is similar to what is used for pregnant women, where there's a little gap where the belly is so that the pregnant belly can rest down. And they were trying to use that for people who had large abdomens to allow them to lie comfortably on their belly. Some of those patients might be able to do the deep breathing lying on their side instead of lying on the belly, and they might be able to go to lie on both sides and might get equal benefits. We don't know because, as far as I know, no one has tried that. Um, Someone asked if how do we get more doctors to implement this in COVID hospitals without very large public data? Um, that's a very good question. I think that if we can emphasize the general safety of the technique that I've described to you, if we can emphasize that this proning has been used now in hospitals over the last number of years where people are put on their belly while they're on the respirator, and that's considered safe in that very serious situation. I think if we can present that information, that will be helpful. I will also mention that Harvard University in the United States, and I believe the Indian Yoga Association in India, are both starting a study to compare yoga practitioners to non-practitioners to look at the incidence of COVID-19 in those two different groups. So if we start to get some data back from those studies that are accepting study applicants right now. In fact, if you go online, you can look up the link for the Harvard study. They're looking for people to participate. If we can get some early information back that the incidence of COVID is lower in the yoga practitioners, that's going to be great information for convincing those hospitals as well. I'm not seeing any new questions from the feed. Do my live assistants have anything else they want to ask me before we sign off?